Doctors don't want another software tool that saves them a few minutes a day. Doctors want other doctors they can know and trust. That's why 70% of healthcare spend goes to labour and less than 1% to software. We're building the Doctor OS to reduce the cost of making clinical decisions, starting with employing doctors to work remotely in the NHS from abroad. I'm Max, and I spent the last 4 years working on health and trade policy in the UK Parliament. Last year, I came across a regulatory change that I thought could reduce the cost of employing doctors by 60%. Together with Julian, a second-time founder who scaled products to 50,000 users, we've spent the last 12 months solving how this regulatory change can be used in practice. And today, we are the first and only company in the country to be approved to use this regulatory change. That means we are the only ones who can hire doctors based abroad to work remotely in the NHS, reducing the cost of employing a doctor by 60% compared to the UK-based equivalents.
Our first pilot started at a GP practice in Manchester in early April. In total, we've signed £45,000 in profitable pilots, and we already have another £12 million ARR in the pipeline. Creating distribution of thousands of doctors working in all parts of the healthcare system is the first step towards turning healthcare into an AI-enabled service at scale. Adding tech allows us to reduce the cost of making clinical decisions by more than 90% in the future. Our Doctor OS will integrate clinical workflows to improve the productivity of our doctors. We'll let any healthcare provider access them for the most cost-effective way to make any clinical decision, whether that's doctor-led admin work in a clinic, medication access providers writing prescriptions, or an insurer doing patient consultations. The staffing crisis won't be solved by another SaaS. It'll be solved by expanding doctor supply and using tech to 3x productivity at a fraction of the cost. We're solving the healthcare staffing crisis and would love for you to join us.